and welcome to our Gold Learning viewers. I'm Fiona Lang-Sharp, IBCLC and Director of Communications here at Gold Learning. Today I have the pleasure of sitting down with Michael Narvey, who's going to be speaking at our upcoming Gold Neonatal Conference, which begins on June 4th. And Michael's going to be speaking to sweet and sour hypoglycemia in the newborn. Welcome back, Michael, to our Gold Neonatal Conference.
Well, thank you for having me.
Well, I am very excited to have you, fellow Canadian. I know that you're a little bit native to even my hometown, which is pretty exciting, but I'm going to have you reintroduce yourself to our listening audience today, and then just tell them a little bit about what you do and where you are in the part of Canada.
Sure. So I'm a neonatologist, and I've been in practice since 2004. So I suppose you could say I'm beginning to get into my mid-career phase. I do clinical neonatology here at the University of Manitoba, and in addition have a fairly large role in leadership, as I'm the section head of neonatology here, or as some places would call a division head. And in addition, I'm also interested in neonatal transport and am the medical director here of our child health transport team.
That's amazing. And that's such a specific area as well. I always admire how incredibly detailed it is to be in that sort of transport team. And it's just amazing. I've seen them work many times. So a lot of kudos to, how they put everything together and how they, transport these fragile little ones for sure. That's amazing.
Yeah, thank you.
Yeah. So let's talk a little bit about your topic here that you're going to be speaking to. So sweet and sour hypoglycemia in the newborn. Perhaps you can tell me a little bit about when you first became interested in this and why the whys and hows. I know a little bit of the background on this, but I want you to explain to us a little bit of how this came to fruition for you.
Sure. I think the story begins near the beginning of my career as I became very interested in trying to minimize pokes for newborns. And one of the most frequent reasons that we do poke a newborn is to check a blood sugar. So this became an interest of mine, looking at what thresholds we use to determine when we need to check sugars and when we need to do something about them, and when babies need IVs specifically, which is obviously a fairly invasive way to deal with a low blood sugar. So the story really then continues when, as a member of the Fetus and Newborn Committee, we, as you may be aware, have a statement on the management of hypoglycemia. And this was up for a revision. And so myself and Dr. Marks, who is also here in Winnipeg, decided to take on this task of trying to look at how to revise the statement and really modernize it. So the journey really finishes with me telling the story to the listeners out there when you attend the lecture online, that over the course of our journey looking into developing or modifying the existing statement, we certainly encountered some very positive things, and we encountered some things that one might say could be a little sour. And I think that the journey that we went through is a very interesting one. There's some cautionary tales, and I think there's also some very interesting information that one will hear about how much we should trust so-called experts. And I'll leave it at that as a tease.
Wow, you had me just on the cuff there. As my mind is whirling and I am placing myself with those newborns and, and I'm a birth advocate and a doula, and so a lot of the things that I do, of course, is educate parents and tell them what's happening so that they can be reassured. But it is very frightening when, for a family, they have to go through and experience these types of things with the newborn. And then, of course, there's all the, sensitization and desensitization of newborns as well and what happens. So I just feel like I'm on the edge of my seat right now, Michael. Thank you for that.
You're welcome.
Well, I'm really looking forward to hearing more for sure. Is there anything else that you want to give us just a snippet of what you're hoping the audience will take away from this presentation?
Well, I think the audience will be expected to hear, a lot of information. Well, you'll hear a lot of information that will make you wonder as to how one ever decides what a normal glucose is and what to do about a glucose that's low. What I'm hoping that the listener will leave with are really questions, lots of questions that I hope I can provide some answers for, but really some questions and some understanding as to what direction we are likely going to be going with our new statement in Canada, and coming to understand the rationale behind that. Um, and so it will be thought provoking. It no doubt will invoke people to think about questions that they hadn't thought about before. And in the end, every center and every listener will need to decide what's the right fit for them and their babies.
Wonderful. That's great. And it'll be great to hear and see those discussions online. So thank you so much, Michael Narvey, for being with us here today. It's been great chatting with you once again.
Uh, and the same to you.
And so we have you, you're going to be here with us live on Wednesday, the 13th of June. So for our audience listening in, please note that you can join us for this live conversation. And of course, if you can't make it, it will be recorded. So lots of opportunity. And we have our discussion boards too, where you'll be able to ask questions afterwards. So there'll be a live Q&A as well. Go to the website to see all the local times, of course, for yourself. So goldneonatal.com. And also join us for our opening keynote. The conference kicks off on June 4th. That will be a live and open access presentation as well. So we'll look forward to seeing you all there as well. Well, thank you again to Dr. Michael Narvey for joining us here today and to our listening audience. Bye-bye for now, everyone.